Can reducing sodium prevent a stroke? Can reducing sodium intake actually help prevent a stroke? This is a crucial question, especially since stroke is a leading cause of death and disability worldwide. The answer is yes. Reducing sodium can play a significant role in stroke prevention, primarily by lowering blood pressure, which is a major risk factor for stroke. When we consume too much sodium, it can lead to higher blood pressure. Elevated blood pressure, or hypertension, significantly increases the risk of both ischemic strokes, which occur when blood flow to the brain is blocked, and hemorrhagic strokes, which happen when a blood vessel in the brain bursts. Research shows that excess sodium intake causes the body to retain more fluid. This increases the volume of blood, which puts extra pressure on blood vessel walls. Lowering sodium intake has been consistently linked to reductions in systolic blood pressure, particularly in older adults and those with existing hypertension. For example, studies have demonstrated that when sodium intake is reduced, blood pressure decreases. One notable study from South Africa found that mandatory sodium regulations in processed foods led to a reduction in sodium excretion and lowered systolic blood pressure significantly. In addition, the salt substitute and stroke study, a large randomized trial, revealed that using a potassium-enriched salt substitute, which reduces sodium intake, significantly lowered systolic blood pressure and reduced the risk of stroke by about 14%. Meta-analyses also indicate that individuals consuming sodium above recommended levels have a higher risk of stroke. Lowering sodium intake to recommended levels, which is less than 2,300 milligrams per day for the general population, and ideally 1,500 milligrams for those at higher risk, is associated with reduced stroke risk. Reducing sodium not only lowers blood pressure but may also improve other cardiovascular health markers. For instance, lower sodium intake is linked to reduced levels of NT-proBNP, a marker of heart strain. So, how can individuals practically reduce sodium in their diets? One effective strategy is to cut back on processed foods, which are often high in sodium. Using salt substitutes that replace some sodium chloride with potassium chloride can also help. Additionally, individuals should aim to reduce added salt in cooking and avoid high-sodium processed items like canned soups and fast foods. In summary, reducing sodium intake is a well-supported strategy for lowering blood pressure and preventing strokes. This approach aligns with current medical guidelines and is an essential part of dietary strategies for stroke prevention. However, sodium reduction should be part of a broader lifestyle approach that includes other healthy habits. Always consult healthcare professionals for personalized advice tailored to individual health needs.